Okay, this is the second video for my assessment. Okay, gonna show you around first. All right. Now I'm going to show you where I'm going to be grabbing my equipment from. This is where I'm gonna be grabbing my equipment from. And I'm gonna show you the front and back of my prompt card and my cold spa. This is my CVPV assessment. Okay, so here's the front and back of my weekly assessment, prompt card, front and back. I'm gonna perform hand hygiene. Now I'm gonna walk in the room and introduce myself. Hi, my name is Jaleesa. I'm going to be your student nurse today. May you say me your name and date of birth?
It's 5/13/1997.
Okay, now I'm gonna identify the patient two ways. So she already stated me her name and date of birth. Now I'm gonna look at her wristband and see if it's the same. Alrighty, so 5/13/97, okay. Now I'm going to, so I already identified, I'm going to explain the procedure to the patient. I'm going to be doing a cardiovascular assessment on you and a peripheral vascular assessment on you as well. If you have any questions, fatigue, or if you feel any discomfort, please let me know. And now I'm going to ask the patient a couple questions. Do you have any symptoms right now of chest pain?
I do not.
Palpitation?
I do not.
Any dizziness?
No, I don't.
Any skin changes? Swelling in the ankles?
Nope.
Do you have leg pain right now?
I do not.
Do you have family history of diabetes? Elevated cholesterol?
No.
High blood pressure?
No.
Any heart surgery? Family history of heart problems? Have they been diagnosed with rheumatic fever?
No.
Okay. Do you smoke or use tobacco?
No, I do not.
Have you ever?
No, I have not.
Do you exercise daily?
Yes, I do.
Do you have a sleep routine?
I sleep about six hours at night.
Any stressors?
School, practice,
Okay.
work.
And do you have a diet, like a daily diet?
Yes, I try to eat 3 times a day and snack periodically with unhealthy fruits.
Do you take any medications for your heart or any circulatory problems?
No, I don't.
Do you monitor your blood pressure?
I do not.
Okay. Now I'm going to gather my equipment because I'm gonna be taking her vitals now. So the first thing I'm gonna do is take the temperature. Okay, 97.9 is the temp. Okay, gonna do count heart rate and respiratory rate. Okay, nice and yeah. rate was 65, respiratory rate was 14, and heart rate was normal, rhythm was regular, and respiratory rate normal, rhythm regular, the amplitude of the heart rate was +2, and the depth was normal. Now I'm going to do blood pressure. So if you don't mind taking your arm out just like this. Okay. Okay. Blood pressure was 108/70. Okay, so next I'm going to lay the patient down in supine position. Okay, so if you don't mind laying back for me. All the way back. Now if this was a bed, actual hospital bed, then I would, rise it up, come to a position. Okay, so I'm going to pull your gown down just a little bit. I'm going to be observing now your jugular venous pulse. So now, okay, I see it right there. Now I'm going to shine a light. I should probably have my equipment ready. Now I'm going to shine a light towards it to to see more pulsation on it and to take a look at the shadow of it as well. And then after that, I'm going to look at the pulse of the suprasternal notch around the clavicle. Alright, good. Now I'm going to elevate the patient about 30 to 45 degrees. So I'm going to elevate you just a bit. So I'm going to put this pillow back here. Okay. There you go. Now this, I'm going to watch the distension of your jugular vein. And I'm going to shine a light and look for any distension, any perfusion or bulging. Alright, now I'm going to measure. Oh, I'm sorry. Alright. I'm going to measure this in inches. about 1.5, less than 3 is normal. And next I'm going to, now if I were to need to auscultate for the carotid arteries, I would, the patient would have a cardiovascular disease. So either the patient is middle age or old age, middle or old age. And that is, I would place the stethoscope, place the bell of the stethoscope on the carotid artery to listen for breathing sound. Breath sound, sorry. Now I'm going to palpitate the carotid arteries on each side beside the sternocleidomastoid muscle. Now I'm going to do it one at a time because if I do both at the same time, that's going to affect the difference. Okay. So they're palpable. And the amplitude is +2, contour is smooth and rapid, and elasticity feels very elastic. And there are no throats that were felt. And now I'm going to have the, okay, so I'm going to pull down your gown if that's okay with you. Okay, so now I'm going to locate the apical pulse, which is on this left intercostal medial. It's going to be on the left intercostal side. Now I'm going to inspect it. Okay. And now, if anything was abnormal, I would do a pulse, check for a pulse rate deficit, where I would auscultate the apical pulse and feel the radial pulse. I'm sorry, palmar surface to palpitate the apex for the abnormal pulse. And now I'm going to palpitate it. So I searched for it, now I'm going to palpitate it. Okay, and now I'm going to auscultate the rhythm, the apex of the heart. And if anything was to be abnormal, I would auscultate for pulse rate deficit by auscultating for 1 minute and feeling on the radial pulse at the same time. Okay? And now I'm going to listen for S1 and S2. Now S1 should sound loud at the apex of the heart, and it should also sound loud at the base of the heart. S1 again. And I'm also going to be listening for any extra heart sounds and murmurs as I am after I listen to S1 and S2. Okay. And first it's going to be with the diaphragm of the bell. Okay, sounds pretty good. Now I'm going to listen to the 5 points, and that's first going to be with the bell, and then I'm going to listen again to the 5 points with with the diaphragm first and then the bell after. Okay, now I'm gonna listen for any bruits, if there's any, with the bell. Okay, so everything sounds pretty good. And now I'm going to have the patient sit up for me. And this is when I'm going to listen the apex of the heart sitting up. And go ahead, I'm gonna have you exhale for me. Okay, that sounds pretty good as well. And now I'm going to going down to the arms now. So I'm gonna okay, so you can lay back if you want. Now I'm going to inspect the arms for any lesions or ulcers on both arms and make sure and observe the skin, the color of the hands. And I'm going to then palpitate for warmth, tenderness, pain, sensation of the arms, and this will be on both. And then I'm going to palpitate for the radial and ulnar pulses and the epitrochlear pulse. And while I'm doing that, I might as well see if the lymph nodes are swollen. I'm doing it on the other arm as well. Okay, there, everything is palpable. And I'm going to palpitate the hands, and I'm going to capillary refill time. So see if the blood flow goes back rapidly. And it looks good. Now I'm going to perform the Allen's test. I'm going to press on the radial and ulnar with both my thumbs, and I'm going to have a patient squeeze the hand. Okay, let go. And blood flow is coming back. Okay, and right here as well, I was supposed to do the capillary refill time. It should come back within 2 to 3 seconds. And now I'm going to do the Allen's test on this side, this arm, hand here. Go ahead and press. And let go. And blood flow is coming back as well. Now I'm going to inspect the legs. So go ahead and put that. Okay, sorry, phone's probably dying. Okay, so now I'm going to inspect the legs for any lesions, ulcers, and hair distribution, and varicosity and thrombophlebitis. And this one, and then I'm going to palpitate both legs, and for warmth, tenderness, pain, sensation. And then I'm going to palpitate the femoral, and then feel for the lymph nodes, or if there's any coming out. Then I'm going to auscultate femoral pulse. Okay. Now I'm going to palpitate the bilateral on both legs. Okay. And now the posterior tibialis. And they're palpable. And then I'm going to, and then I'm going to the dorsalis pedis on both. Okay, it's palpable. I'm gonna do a capillary refill time on the toes as well. And okay, and blood flow seems to come back rapidly. Okay. And on the hair distribution, hair seemed to come out evenly, no patches. And that concludes the end of my CVPV assessment. I'm going to place the patient in a comfortable position. I'm going to cover their mouth. I'm sorry. And there you go. Kind of covered. Place the call bell within reach. Here's the call bell. Do you have any questions or concerns?
No, I do not.
Okay, and I'm going to perform hand hygiene. Notate my findings on my weekly assessment form and finish up writing my vitals on there as well. I'm gonna show you again. So I'll write my vitals at the end, and here's the front and back of my pump card, and here's the front and back of that, and that's all.